The study I'm referring to was done by a really good nonprofit in the Twin Cities called Growth and Justice. They hired the Lewin Group, which, by the way, is owned. The Lewin Group are professional number crunchers for health economics. Lewin Group is owned by United Healthcare. If anything, they're prejudiced the other way. So Lewin Group looked at a plan that is very, very similar to the Minnesota Health Plan, almost identical, and found out that as soon as we institute it, we cover everybody in the state, all the non-elderly, well, actually elderly too, everybody, 5.2 million people, and we have a comprehensive benefit set, and we pay 9% less as a statewide health bill to do that. And that differential grows over time to up to 33% discount over what we would be paying at that time under the current system. In fact, this is the chart right here, whereby the blue line represents the costs of the Minnesota Health Plan lookalike that Growth and Justice studied, and the red line are the current trends that are based on implementation of the Affordable Care Act in 2014. The differential when you get out a few years is incredible. And indeed, that is the track record with single-payer systems. They manage to control costs to a much more effective degree than the way we do it now. So the federal Congress also has its version of single payer, H.R. 676, introduced by John Conyers. I believe it used to be Paul Wellstone who would introduce it in Congress, and then he'd come back to Minnesota and say, yeah, I did it, but we got to have campaign finance reform in order to make it succeed. So, but that's another story. So how do we go about getting this done? How do we influence people in the legislature to bring about single payer? I'm going to skip Bill Moyers, unfortunately, but here is our strategy. Winston Churchill did not say this, even though everybody thinks he did. What's happening right now in the legislature, Senator Carlson can testify, is that we are exhausting all the other possibilities. In the legislature right now, we need to admit that all the energy is going into making the best implementation of the Affordable Care Act that we can, given the fact that it's the law of the land. I think that's a great thing to do. However, that means that we use this period to marshal our forces, to line up our legislators, to get co-authors on Senator Marty's bill, and to be ready to move when we can move. And speaking of moving,
5 minutes.
Right. So here's the other half of the strategy. That's Lyndon Johnson talking to Wilbur Mills in a recorded telephone conversation. Typical Lyndon Johnson. However, he is mostly quoting his mentor, Sam Rayburn, who had the dead cats analogy that's often attributed to LBJ. But the point of it is, and by the way, you know what they were talking about? Or typically LBJ was doing the talking. They were talking about Medicare. They were talking about getting Medicare out of the Ways and Means Committee onto the floor. And LBJ was saying, we got to do this, well, in his own inimitable way, we have to do this quickly. And that's the way it'll go. When people realize that our time has come, we have to be ready to move. So that's what we need to do now. So the reality of the situation is that we need to give the ACA some space to get implemented. There are some other factors. Saying it quite bluntly, Governor Dayton is in his first term. Governor Dayton may be an even better ally than he is now in his second term. Thirdly, there's a provision within the Affordable Care Act that says you can't do anything different until the year 2017. as a state. That is the famous Section 1332. You can look it up. So we can approach the feds and say, okay, it's 2017, we want to do something different. That means that we have to start holding our hearings and being successful in the legislature probably in the next biennium and get this thing through. Between now and then, that's the marshaling our forces period when we've got to line up our support. But we need to get as many of these people as possible on board as co-authors to the Minnesota Health Plan. And that means that, you know, we're now over to you to help us get this done. And there's an array of people you can join with to help with this effort. That's me at the top. Sorry about that, but there I am. And my email address, I'd be happy to converse with you, as would Sharon, as would Ellen. I'm the webmaster for mnhealthplan.org, an informational site about the health plan. For getting it done in the state of Minnesota, the action has been largely through Healthcare for All, there we go, Healthcare for All Minnesota, hcam.org, which has the committees looking at the legislature and doing advocacy. The Physicians for a National Health Program, if you happen to be a provider in the medical community, like Ellen, for example, that's a really great outfit. And I think I would also need to mention that when it comes to doing the best thing possible with implementation of the Affordable Care Act, Take Action has been doing some wonderful work at the legislature. Had a little bit of discussion with Take Action back during the Affordable Care Act when we were trying to convince them to give some room at the table for single payer. But thank you.
So, you know, we have just a few minutes to answer a couple of questions. I wanted to introduce also Papa John Kolstad. Some of you know him. He's been in the fight for a long time with us. Musician, businessman, and a very strong supporter of the single payer bill. So, okay. Who has questions here?
I was just wondering if the studies that have been done have taken into consideration the impact on doctor availability. I mean, if you have one state kind of in the middle of the country that has lower costs, it means that the doctors are probably getting reimbursed less. And so is there any consideration taken for the impact that might have on doctors moving out of the state and availability?
It isn't necessarily the case that doctors would be compensated less. It is the case that other countries that have had nationally organized healthcare systems have tended to pay medical people less than they gain in the United States. But we spend so much money in the U.S. that it isn't necessarily the case that doctors have to take a cut. What will happen, however, in terms of doctor availability, is that utilization probably will go up. Once people get coverage, once people can get in to see a doctor with their issues, they were disincented before from seeking help, and so they're going to be crowding into doctors' offices. We are going to need more doctors, particularly on the primary care end, the family physician end, and we're going to need them not necessarily here in Burnsville. We're going to need them in Canada-Ojai County. We're going to need them in, I want to say outstate. I've been taught not to say that. Greater Minnesota. Thank you. If we have a statewide organized healthcare system, we would be able to institute programs that could entice, I think, more people into med school and also greater Minnesota.
We have time for one more question.
Uh-oh.
Let's go to the man in the blue sweatshirt.
Well, I got a question about the federal Medicare program. You talk about all Minnesotans are be covered under this, and then you talk about a tax, 7% and 8%. I mean, how does that affect people who are on Medicare? And then you also mentioned about nursing home coverage, which would potentially be people who are on Medicare who could actually go to nursing home.
Yeah, The intent of the Minnesota Health Plan is to ask for waivers from the federal government that would allow those who are on Medicare now to enter the Minnesota Health Plan, which has a better and more comprehensive benefit set. If you are not receiving a payroll wage, then you would not be paying the premium into the program. But by getting a federal waiver, the feds would transfer to the Minnesota Health Fund that portion of the Medicare Trust Fund which covers Minnesotans. The feds may say yes and they may say no. If they say no, then it's just condition normal for the approximately 1 million Minnesotans on Medicare, and they would not be part of the Minnesota Health Plan system. If they say yes, you'd be welcomed into the system with a larger benefit set, and you would not have to pay payroll taxes.
There'd be no premium?
So,
There'd be no premium?
um,
You say yes?
whether the, I don't know yet, I don't think anybody knows yet whether the Part A fee or premium that you're paying now to Medicare would stay with that program if it's melted into the Minnesota Health Plan. I'm not sure about that. I would promise to ask Senator Marty whether he's thought that through and get back to Sue.
Can I take part of the cost question? Because this is the last question, this is the only chance I'll have. I was a business person for over 35 years, and I'm now on Medicare, and by the way, I love it. It's a great program, and I love working with the federal people that put it together. But what I realized, I used to think I paid for health care for my employees. I paid for all the costs for all my employees, including my family. But after a while, I realized, I started working with the healthcare people, I realized that I wasn't paying for that health care as long as I could pass it on to my customers. As a business person, that's what you do with the business expense. So all my cost of health care went on to my customers, and then they passed it on to their customers because I was in wholesale. So I realized, it was one of those light bulb moments for me, is that I realized that I don't pay for it, then who does? I realized it's anybody who buys any good or service in America or in Minnesota, and anybody who pays any tax in Minnesota or the United States. That means that every one of us, every time we make any purchase or pay any tax or any sales tax, part of that is paying for the health care that we get. So I'm really kind of a fiscal conservative as a business person and as a human. And I realize that if I'm going to be spending my money, I want to spend it where I get the most bang for my buck. And that's what single payer is, and that's why I so passionately have been working for it for all these years.
One thing I wanted to mention, we have some handouts at the, thank you.
Yep.
We have some handouts at the table. Be cautious about bill numbers. Some of the handouts are from previous years when the bill numbers were different. The current bill numbers are Senate File 18 and House File 76, as opposed to what you may see on the handouts.
And we have postcards in the back. If any of you would like to address a postcard to your legislator, you can do so. We've got the postcards there.
Big thank you for it. Yes,
Well, before we have to move around a little bit, this was just the tip of the iceberg.